Hello, everyone, and welcome to another Women's Health Tech Wednesdays. My name is Nina Joshi, your host, and I am very excited to bring on our guest today, Sari Kaganoff, who is the General Manager of Consulting at Rock Health. She leads the consulting team on advising enterprise companies on digital health strategy and innovation. So today will be all about digital health, which I know is a very exciting topic. Before we jump into the conversation, we love questions, so please feel free to ask any in the chat or on the Q&A feature at the bottom of the screen. So with that, would like to formally bring on our guest, Sari. Hi, Sari, thanks so much for joining us today.
Hi, Nina, thanks for having me.
Yeah, absolutely. So maybe to kick things off, would love if you could share with us a little bit more about yourself and your journey into the healthcare industry.
Of course. So firstly, you've already mentioned kind of my current role, but just to make sure everyone knows kind of what I do today, Rock Health is a company that's been in the digital health space since 2010. We have three main parts to our business. We're a venture capital fund investing in early stage digital health startups. We have an advisory business, which advises enterprise companies on digital health strategy and innovation. And we have a nonprofit arm focused on health equity and education. So really the gamut of supporting digital health from all angles. So I came to Rock Health about 1.5 years ago from McKinsey & Company, where I was for 7 years, co-leading their work in digital health and patient experience. When I joined McKinsey, about a year in, I did my first digital health project, and this is ages ago by now. And I was just like, wow, this is the future. I just have to do more of this. And so that is really where I directed my career within McKinsey, doing a lot of healthcare and life science projects, but really as much as I could doing digital health and, building out the health tech network at McKinsey. And then, around the time when COVID hit, I just felt this sort of like pre-FOMO of like, this is going to be the moment for digital health to take off. And I want to be closer to that industry and really in the action. So I came to Rock Health to kind of really help support and drive the industry forward and be in the thick of it. So that's me. Before that, I worked in, I got an MBA from Booth. I worked in fintech before, so not much of a healthcare background before McKinsey. In particular, related to the women's health topic, not something I mention every time, but I'm a mom of 5 kids. And, for me, maternal health, I feel like, you sort of go on a journey, especially with having as many kids as I do. So, each one you learn a little more and you get a little more experience, and you realize that there's so much knowledge and, insight on motherhood, birthing, pregnancy that you just don't have because, most people don't have too many children. Their parents didn't have too many children. So we don't really pass on that knowledge as much as they used to in like the olden days. And so I think there's really a need for more support systems and tools for moms. And I think digital health has a great opportunity to fill some of those gaps. Obviously, there's other things in women's health as well, but I think that's, a particular area where I feel really passionate about is maternal health. Anyway, so that's me for today.
No, I love it. I think, you being able to understand more about your background and really kind of what you're so passionate about, which is kind of that intersection of women's health, specifically as it relates to digital health, I think is, you definitely came at a very good time to Rock Health. And I think, really understanding your experience and your perspective, so curious to get your take on what direction do you see women's health, this industry moving in. Specifically, I know you mentioned Rock Health and the venture arm. Would love to learn your insights about the funding piece specifically for women's digital health.
Yeah, so firstly, it's kind of fascinating when you look at the history of the funding in women's health over the years. So Rock Health has been tracking funding for digital health startups in the headquartered in the United States since 2010, any deal with over 2 million in funding. So we really track a lot of that data. And what you see is that 2021, there was actually around $1.4 billion invested in women's health, digital health across 37 deals. And that was actually about 5% a little under 5% of the total digital health funding that year, which was 29.1 billion in total. So very high record, a high record year, but 5% of that was for women's health. And when you look more historically, in 2018 and on, it sort of hovered around the 5% mark, other than 2019, which was around 10%. But in the prior years, it was really only 1 to 2% of funding every year. So from when we started to track, it was really this like tiny amount. And now it's grown to more of like a 5%. Now, is 5% enough? Is it? I don't know. Probably you could say that there's more opportunity, but definitely it has grown in the last 3-4 years. And in fact, when we track specific, we track different, different therapeutic areas, not that women's health is one therapeutic area, so that's an issue, but if you compare it to others, it's actually one of the leading therapeutic areas to receive funding in terms of amount. So, so at least it's grown in the last few years. I do think though, that there's a lot of opportunity for even further growth. And I would say one is just anecdotally, because a lot more people are interested, excited, finally waking up to the fact that this is a really robust area, kind of a white space of need. But also we saw in 2021 that over 50% of the funding actually went to seed stage companies. Wow. Which is really exciting, because that means there's a lot of new companies coming into the market to address needs. So it's not like all that money is going into, the 2 or 3 kind of later stage big companies. It's really more, a lot of it to early stage. So I'm pretty excited, because I see now also our fund invests in very early stage companies, seed and A. So we see a lot of those early companies, and there's a lot of interesting and exciting things emerging. So I think that we're just kind of at the beginning of this wave. So I think there's a lot of opportunity.
That's incredible. Yeah, like we're on the precipice of something even greater, but I think it is really interesting that you've been able to really leverage and see that data kind of across over time, and how women's investments have been going specifically, with women founders. I think that's really interesting.
Yeah. So yeah, at Rock Health, we track as well. It's good that you mentioned it. So we track the funding. We've also tracked the founders of companies. So, there's some research we can dig into, around companies founded by women, which I can share with you after as well. Pretty interesting. Many of the women's health companies are founded by women as well, almost all. But there's also kind of different areas there.
Yeah, absolutely. So interesting. Kind of speaking more on the digital health space, one of the things that you really spend time looking at is, digital health from a strategy innovation perspective. Would also love to learn more about, your experience and your lens on adoption for digital health, especially now. But I think, even across the board, I feel like there's been a push towards digital kind of across various industries, but would love to kind of get your perspective on digital health specifically for women's health.
Yeah. So firstly, it's really fascinating to see, because we have actually seen some changes in the last couple of years, and it's kind of a fun time. I mean, it's a difficult time for the world, but it's a fun time to be in the market, because things are changing and are really different than what they were before. So one of the types of data that we do collect at Rock Health is we run consumer adoption surveys annually, surveying around 8,000 consumers who are representative of the US population. And we ask a number of questions around adoption of digital health, different types of tools, different types of technologies, their attitude toward different metrics they're tracking, who they're willing to share their data with, et cetera. What I think is fascinating, sort of two different things that I'll talk through today. The first one is around, if you look at the split of women versus men using digital health. In fact, when you look at health tracking, so kind of tracking different health metrics, in 2021 was the first year that women pulled ahead of men in the terms of the percent of them who actually are tracking their health data. So in 2021, 57% of women reported that they were digitally tracking their health. Only 55% of men reported that. But if you look at the prior years, it was 50% women, and the 2019 was 43% women. So there's quite an uptick, a pretty significant uptick in women tracking their health. So that's kind of one thing. In terms of wearables, you also see women are about even of men. So 44% of women said that they use a wearable of some sort. And in the telemedicine space, 50% of women said they use live telemedicine, and that's up significantly. 2020 was only 35%, and 2019 only 28%. So it's really becoming much more standard and normal. But I think it's fascinating that in the tracking metrics, women actually pulled ahead of men at this point in time. But then it's also interesting if you look at those tracking, like what are people tracking? We actually ask them about the different things that they're tracking and whether they also, if they are tracking a metric, are they using digital tools or analog tools to track? What I thought was very interesting is, some of the lead things that people track are obviously weight and food and diet. But then there's sleep is another one. Mental health is a pretty big tracking metric.
Interesting.
Yeah. And, what then you get to some like specific women's health issues or topics, and 23% of women said they track their menstrual cycle. And of those, 72% are using a digital tool to track. And that can be anything from a dedicated app to it could be like just, using
the notes app.
The notes app, right? So any kind of digital tool. And then 5% of women reported tracking fertility, but those who are tracking fertility, 85% are using a digital tool. So it seems like menstruation, fertility are really, those women who are tracking are pretty much using a digital tool. Similarly with sleep, blood sugar. And then when you get to like weight, food, diet, and mental health, it's more like 50-50 or kind of 40-60 on the analog to digital side. But we really see a big range of types of things people are tracking and a lot of focus on kind of digital tracking for those tools. So, it's pretty interesting to see that space growing and like the consumer need and preferences growing there.
That's so interesting. And I even wonder, are more and more people just getting an awareness of just health kind of as a broader topic and wanting to be cognizant and kind of on top of, learning more about their body and feeling like they're in control of their body in that way. That's really fascinating.
I think so. And I also think COVID sort of drove that a little bit because, before COVID, I think a lot of the health conversation was sort of more in the realm of doctors and, whoever else. And suddenly with COVID, people are like, wait, I need to be thinking about my health, the world around me. And so there's sort of this awareness of like, you need to take care of yourself and your family. So I think that also drove it, and just a kind of familiarity with digital tools and technologies and everything moving online sort of helped people, move to that. I know for one, my husband bought me an Apple Watch. I think that the day they announced that schools were closing for lockdown, he like went to the mall and got the Switch and the Apple Watch and was like, all right, we're moving digital. So, and I used it to track my activity all that time in quarantine, when we were all like in quarantine. So I think it's pretty interesting.
That's so fascinating. There was something that you mentioned too. Curious if you just kind of know off the top of your head, you said something about like, you also measured sentiments around privacy. Have you noticed anything major, or was it kind of on par with what you would expect?
Yeah, so I think what's interesting there, and I don't have all the stats on the top of my head, but I can tell you the general trend there is that people are much more willing. There are two interesting things. So number one is people are much more willing to share their health data when there is a clear benefit to them from a health perspective. Versus like for money, a lot of people will say, no, I'm not going to share it for money, but I will share it if it'll help me get a better diagnosis or help me better track this health metric or et cetera. So that's pretty interesting. The other thing that's very interesting is you can see who people are willing to, or at least who they say they're willing to share their data with. And we ask them about providers and payers and pharmacists and all that. This past couple of years, there's been a big uptick in those willing to share with employers. And I think it's just the necessity of COVID where you suddenly realize that you have to be able to share. In prior years, it was very low. Interestingly, usually tech companies rank pretty low. So folks will say, no, I don't really want to share my data with the tech company. I think this is fascinating because I think that people share their data all the time with tech companies and they don't necessarily realize that they're doing it. So I think having everyone sort of become a little bit more aware and educated on what is actually happening with their data. And then maybe it's fine because they're actually getting that better outcome that they said they would trade it for, right? And so maybe it's okay, but I think being a little bit more cognizant of when you're using a tool, it's collecting data on you. And so, so I think there's a little bit of education around there that is happening, but generally we do see folks more willing to share with providers and, other things like that versus tech companies usually rank pretty low, as well as pharma companies and other things like that.
That's so interesting. And it makes a lot of sense, being able to have that transparency of how exactly is this information going to be used and how is that going to then translate to helping me. So fascinating. And, based off of what you've been seeing in terms of just general adoption, Would also love to learn from you, tell us a little bit more about solutions kind of in the digital health space for women that you're kind of seeing, gain a lot of traction or that excite you kind of during this time
Yeah.
in the world.
Yeah. So I think I sort of think of it as, I don't know, maybe it's not a nice way to say it, but like the more old school, and then there's the new and expanding new areas of women's health. So in the traditional sense, the last few years, what we've seen, it started off as a lot of fertility companies.
Right.
And I think that made sense also because the fertility space was very direct to consumer or employer focused. And those were two digital health business models that were pretty successful. So that was kind of an early space. Sexual health being very early as well, a lot of birth control and other like STI type of things. And then maternal health, of course, with all sorts, really focusing on pregnancy, postpartum, et cetera. But what we're starting to see now, like very much earlier popping up, is actually either more niche areas of women's health that had maybe been neglected before, like menopause is an interesting new one. There's a number of companies emerging, but also things like chronic diseases and their application in women's health, or even cancer support for women specifically, or primary care and preventative care that are more tailored towards women. And then lastly, something you've mentioned as being particularly interested in, but behavioral health support for women, especially as well. So I think those are the sort of, a lot of the solutions we're seeing today focusing on that. But I think also, even within the maternal health, there's still a lot of new companies because there's a lot of elements to that journey that haven't really been, I see Leslie saying menopause is not niche. I agree with you, absolutely. But I think in women's health, it had been treated as it hadn't been really addressed before. Yes, but you're right. It's a huge area of unmet need, but now there are finally some companies addressing it. Yes, I'll take that back. Not niche, but new and previously untapped. How about we say it that way? Yeah. But yeah, so definitely seeing sort of new areas of focus that are expanding beyond the sort of fertility and sexual health.
Right, absolutely. Yeah, and I think, when we were talking about menopause, it's one of those things where a lot of these things that you also mentioned with chronic disease management, et cetera, when you think about just the number of people that it affects, these are definitely not niche topics, but it's just something that, they haven't had their time in the spotlight. But I'm really glad to see that a lot more people are focused on, making that a priority and kind of making that, a worthwhile investment kind of on that side as well.
Yeah, and I think what's interesting about digital health is that it opens the door for, supporting needs that people aren't necessarily comfortable talking about in person as much. And that's why a lot of these companies started in sexual health. It's even in menopause, a lot of women, talk about not really feeling comfortable discussing their symptoms or discussing what they're going through, but having a community online of other people who are going through the same thing, or having an expert physician who actually knows what's going on and can talk to you about it and help give you options. Those are things that are sometimes a lot easier to do in a digital world, or to find the right people and connect the right people versus going to your in-person male primary care physician or whoever you might have gone to before.
Totally. You had mentioned something really interesting, when we think about digital health, there's like the telehealth and kind of that access improvement, but you had mentioned something about communities, which is so interesting. Have you been seeing a lot of those types of companies, whether that's just for, just general bonding or around specific topics, kind of come up during this time?
Yeah, I mean, there's definitely a big explosion of communities, and you see them all around different types of topics. So there's specific, the kind of been around for a while is a lot of the disease specific communities, whether that be cancer, other niche areas, or even not niche. But a lot of the maternal health companies recently are starting to create communities or kind of mentorships for moms with other moms. On the menopause front as well, like Happify has launched a community for menopause, for women in menopause age. So there's definitely, I think, this recognition that, yeah, it's great to find other people to talk to and share tips with. Whether it be for just a life stage or whether it be for more of a disease state.
Absolutely. Yeah, and I think the timing is definitely right, since I feel like we're just so used to living in a virtual world as well as a physical world, that I think,
Yeah.
the timing is definitely working out for those types of companies. We have some questions from the audience before we jump into the final question that we typically like to ask our guests for Women's Health Tech Wednesdays. So the first question is actually around the survey and kind of some of the consumer insights. One of our participants wanted to know if this information that you were sharing is available on the Rock Health website, or any other
definitely.
areas.
You can, if you go on the Rock Health website under insights and look for things labeled as consumer adoption, you can usually find those. I'm not sure if every cut that I mentioned is on there, but definitely most of the data is there. And it covers a lot of different topics that we ask folks. So you can definitely look there. And I think this year we're rolling it out, the 2021 survey data in a series. So we published a telemedicine article a couple of weeks ago, and we'll have a deep dive on health tracking coming in a few weeks. But also, if you look back to 2020 and prior years, we have it all on there as well.
Awesome. And then we also had a question of, have you noticed that women are reluctant to share information related to their wearables? So like their Fitbit information or things like that. I know you kind of mentioned it in the context of maybe with a physician, but are there any other instances where you would see that?
Right. I can't say that I've dug specifically into that. We've more asked about their health data generally. So
got it.
So I can't really answer that question in specific.
Makes a lot of sense. And then there was also another question of, have you noticed wearables selling information that they're collecting? I don't know if that was also something that you just had the insight into.
Yeah, that's a great question. I think it depends on the company probably, and how they're using the data. If they are selling it, it's anonymized in most cases. But yeah, probably worth looking in the fine print. I mean, even Apple, if you don't check off the box to say, don't use my data, they will use your data, right? So definitely decide if you want to check that box or uncheck it. The default is checked. But usually, I mean, they'll anonymize it. So it's not like they're have your exact personal information, but then, make your choices and proceed accordingly.
Yes. Absolutely. And I think it's, and kind of going off of that, what you were saying earlier too, about just, an awareness that that transparency is needed, I think is also going to be a good next step to kind of make sure that consumers are aware of exactly what's happening to their data.
Yeah, exactly.
All right, awesome. So the final question that we love to ask is, do you have any words of advice for our audience, for the future health tech professionals, aspiring entrepreneurs on the call today?
Yeah, so a couple of thoughts. And the first one, I think that you'll really identify with this, Nina, because you really focus on just user needs design. And I think the first one is start with a user's need, right? And whether that's a mom, whether that's a woman in the menopause age, whether that's someone with a chronic disease, but really don't come at it with a solution, come at it with what is the problem I'm solving. But then I think the next step is really to say, has someone else already solved this, or is someone working on solving it already? And if so, is what you're going to do different than what they're doing? And if not, maybe you just join them or support them. Because we do have a lot of proliferation of many, many solutions. And I think obviously some competition is good, but I think a lot of folks, at least being aware of what's out there and making sure you're not just duplicating, I think is important. And then just kind of on the funding side, I would just flag that there are some women's health focused funds, which I'm sure you've had some of them on this podcast probably, but there's Ria Ventures, Harlem Capital, et cetera. And then there's other funds who are very active in the women's health space, like Lux Capital or Acme. So thinking about when you are ready to get funding, who are those investors who really would support your mission and would identify with what you're doing, and go at it that way instead of just, trying to get funding from anywhere you can. So really thinking about that. What's the user need that I'm solving? Is this way that I'm solving it going to solve the problem or address the opportunity? Am I doing it in a different way than other people are doing it? And then who would support me on this mission and on this journey that kind of believes in what I'm doing?
Absolutely. That was all very, very insightful and very tangible advice. Love that. So if anyone, is inspired, definitely plot out those user journeys, find your customers. Thank you so much, Sari, for such an incredible and an enlightening conversation. Really, really appreciate you taking the time to chat with us today.
course, my pleasure. Thanks for having me.
All right, everyone. So next week, please join us for our next Women's Health Tech Wednesdays, talking to Sane RX. And then also we have a symposium around digital diagnostics next week. So please be sure to check that out. All of the information is going to be available in the chat to register. Wanted to give one huge shout out to Sari for the time. I'm sure a lot of you have so many other questions you want to ask her, so please check out her LinkedIn. That information is also going to be available in the chat as well. And would like to say thank you to our sponsors, Goodwin and Wisdom, for sponsoring this amazing conversation. And thank you all for attending another Women's Health Tech Wednesdays. We will see you next week. Bye, everyone.